Benefits podcast for Tom Quigley from ClaimLinx. Tom, how are you? And oh my goodness, now I'm going to try to stir the pot a bit. Here is our topic for today. Standing out in a crowded market, what makes ClaimLinx different from other health insurance solutions? Tom, what are the key differences between ClaimLinx and its competitors like Lumy and Myastro Health?
Our game plans as are not a lot like an NFL football coach that like this. Every company has a different story, so you have to be able to be flexible enough to devise the plan of action to make it work for that company. So each company has a different story. Problem is all these other companies, they're a one fit all mentality. Doesn't work like that. There's different aspects of what they do, and there's aspects of what other people do. Then yeah, they do make sense. But if you have 20 employees, each have a different story. You don't have a program that allows point we to do. And it's protected over 25 years. These guys are running around with the Perez ideas, all these other ideas, and they're looking at it as get rich quick. But the reality is, we walk down the mountain. That's how to get the best path for each company.
How does ClaimLinx approach to cost savings differ from other companies' offer?
I'm working on 20% of what I said. So you can go get those guys to be their best at. And some of the media and I will work on 20% of your best deal. And I'll win every time.
And those people charge monthly. They don't do that type of fee-based approach.
Some of them, most of them are outsourcing third-party administration. So we're creating ideas to our own third-party administration. They're just handling health insurance, or they're going through traditional insurance agents who are looking to make traditional insurance stuff. Big difference. Not every, I take this individual coverage, health reimbursement. Yeah, it makes sense for a lot of people. It's for everybody though. And the way you're doing it, should plan that allow flexibility. So those artists where the networks are limited, but choice limited, there's a group plan, pay a little more to flexibility with national network. The basics that they can't do the way they're doing it. It's already
right. How does
what they're doing is wrong.
No.
Tax laws are so they don't understand tax law as well as we literally perfected it. And we sorry, we go to his website. I believe it's the word Lion, LYON, and look at the shows he's are.
We're about to launch a new podcast called The Lion's Share. People need to check it out.
Yes.
So, isn't that? Yeah. I'm looking forward. He's going to have you on, by the way. How does ClaimLinx approach to educating? How does ClaimLinx approach to educating clients about their benefits compared to other providers in the market? We're not talking that we're talking people that claim they're like ClaimLinx. That's a good little tagline. They claim they're like ClaimLinx, but they're really not.
Say what they want, but the reality is the reality. Anybody who thoroughly realizes just because they're not working, it's working our information. Sorry. You can't, and then you before you tell me, the best lines I've ever heard was they try to scare them saying, oh, you can't do this or that. And at the end, when they realize it didn't work, they say, we could do the same thing. That's this one through. So you're trying to steer something, he's not going to do the thing. Oh yeah, you're really looking out for that. Well, if you could do the same thing, why haven't you worked on things and why have you $1 million the last 5 years?
Exactly. What feedback have clients given about the differences they've experienced after switching from a competitor to ClaimLinx? You've had some that have gone to some of these competitors. We're not talking the traditional route, but have used some of them to try to save. What did they say?
Employees that have the high cost drugs or have the bills so prior where they were told to call the way it's Taiwan or RC like wherever. Everyone is all thoroughly frustrated. So when they come to us, they actually get to talk to somebody and they get to discounts, drugs, diseases, treatments, hospital discounts, or realize they're eligible for. They like it. The misnomers, HR, the office managers look good as you can think about it. I'm an older rich company, 100 people. I have actually 26 of HR here, but somebody came to me and said, literally, you're throwing away $1 million a year on health insurance. And I found out it was true. No offense. My HR director office manager no longer has a job. They just cost the company $1 million. I can't keep somebody cost you $1 million.
Exactly.
And let's see what we're allowing them to be in charge of that.
Yep.
Okay, so it's on me. We fool me once, you fool me twice, shame on me, we don't get twice. So the point I'm making is you got these 50 HR and office managers who just try to cost because they're trying to make it look bad. Because if they don't, the owners might go, why the hell did we do this 5 years ago? This racist thing. Or
I want to know, this is me as a promoter. I'm getting a band of men together and women to start promoting ClaimLinx as consultants. They're already talking to a ton of people that want to come on board. Don't go to this one network marketing company where you're lucky to get 10 or 20 bucks. And then, by the way, you run out of the product. Contact Tom to be a consultant. That's going to be a good topic, right? We can get a band of people selling to these companies and look out.
oh, we're not selling by any girl.
No, I was talking more network marketing, MLMs, but
We're not selling vitamins.
no, but I want a bunch of vitamins. No, I love some of these health things, by the way, but yeah,
Right.
yeah, but I will promote ClaimLinx to the moon and back. All right. How does ClaimLinx handle plan customization differently compared to other companies? I think customization is where you really differentiate yourself even from those other companies.
Yeah. We're walking down the mountain looking at all the avenues that help all their employees, just 1 or 2% of them. How does this help everybody? They happen to have this situation. What happens? They're good ones. So you have to have an MRI because you hurt your elbow. They get a house hurt their elbow, what they did. And they have to get an MRI. Two choices. They can go to the hospital, MRI that costs $2,000, or they can go to a standalone MRI place and $500. You design your benefits so they pay less if they go to the standalone. You're better off. Both of them, the insurance covers them. The reason they go to the hospital is because the doctors aren't creative, or the doctors now all work to the hospital, or just to the hospital. It's the same MRI, okay?
100%.
So
Yeah.
that's what they're doing. Another one, it's Walgreens, CVS, Grove. Oh man, I need to go to the ER, the urgent care. What is that? Where I think you have the symptoms, or you think you got strep throat, and it's not truly an emergency. You go to Walgreens, CVS, or any of these other little mini meds and stores, and we'll cover that. Yeah, and help everybody realize and everything. They also It's mysterious. Everyone thinks insurance.
Right.
Even if they don't take insurance. So say you want to have a doctor like $50 or $60 or $100 a month for, and if he goes, I'll gladly pay you if I do this for my employees. I'll give you the $5 a month. Thanks.
Exactly.
You go there. You go for it's deductible, but who cares? All the preventative, all the labs are so much cheaper. It's to the labs and get it done 4 times. Wellness isn't going money on health insurance.
No.
Your employees work.
Right. All right. Best place to go is ClaimLinx.com and schedule a call with Tom's team. Appreciate it, Tom.
It's
All right. That was a special simulcast of the Neil Haley Show and the Cutting Edge Benefits Podcast, guys. Take care.